Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about stereotactic surgery. Okay, this is the second type of recent techniques in the radiation therapy. Okay, this is the second type, stereotactic radiosurgery. This is a type of surgery. Okay, it is a minimal invasive form of surgical intervention that makes use of three-dimensional coordinate system to locate small targets inside the body and to perform on them some actions such as ablation, biopsy, lesion, injection, stimulation, implantation and radiosurgery. Okay, this is a minimal invasive form of surgical intervention. It is a minimal. We have in the previous video we have shown about the stereotactic radiotherapy. What are the therapy? What is the stereotactic therapy, and what are the uses and advantages, and what are the types? Here we are going to see about stereotactic surgery. Okay, it is a minimal invasive form of surgical intervention that makes use of three-dimensional coordinate system. Okay, three dimensions, that is x, y and z. Three-dimensional coordinate system to locate small target inside the body to perform on them some actions, to identify a small target in a body and to perform some actions. What kind of actions we can perform on that small kind of body is that ablation. Okay, and the next is biopsy. We can take the tissues and we can send it for biopsy to identify what kind of issues or what kind of cells, what kind of tumor it is that. Okay, next is lesion, injections. We can cure it from injections, and stimulation, implantation and radiosurgery. Okay, these can be made for a smaller target which is present in our body, which is a kind of tumor cells or a cancer cells. Okay, the surgery is used to treat various brain cancers. As I told you already, this is very similar to the is very similar to the stereotactic radiotherapy uses also. You can find it is mainly based for the brain disorders. What all the disorders we have? We'll be having a malignant brain disorder, benign brain disorders and a functional disorders. For all these three disorders, and we'll have different categories in these disorders also. So to cure all the complete brain diseases, we'll be using stereotactic therapy and stereotactic surgeries also. Okay, next is how the procedure takes place. Stereotactic surgery procedure: incision of a skin and exposure of crania surface is made using a scalpel with a sterile blade, and tissue retractor are placed on each side of the cardiac area of interest. The bone surface is gently scraped with a periosteal raspatra or a bone scraper. Okay, we have since it is going to be taken place in the brain, this is mainly based on the brain, so we'll have in the scalp we'll be having a cardiac surface which will be very hard, and that place will be treated very sensitively, since we are going to treat it in the brain, since once the brain gets affected completely, the whole body gets collapsed. So that bone surface will be gently scraped with a periosteal raspatra or a bone scraper. By using a bone scraper, that area can be lightly scrapped. Area where we are going to operate it can be lightly scrapped. it works, this stereotactic surgery works on the basis of three main components. Okay, this works on mainly based on three main components. What are the three main components we have is that a stereotactic planning system includes atlas, multimodality imaging machine tools, multimodality imaging machine tools, coordinates calculator, etc. Planning system includes atlas. Okay, this stereotactic planning system includes atlas, multimodality imaging machine tools, coordinate calculators, etc. A stereoactive devices or apparatus. A stereoactive devices or apparatus is used. Stereoactive localization and placement procedure. This placement procedure is a very important one, where we are going to do the surgery in the brain. Okay, this part is these three parts, these three components are very important one, where it is used to make a surgery in the brain. Thank you.